Just following on from that report, do all the indicators up until this point suggest to you that Omicron is less severe than Delta?
I think it is less severe, but we have to be careful how we use and interpret that language, because if something can spread at 2 or 3 times the rate, that's a different kind of severity, isn't it? That's many cases in our community, and a lot of pressure on our hospitals and a lot of deaths.
Isn't there, I mean, maybe this is wishful thinking on my part and the part of other people, that if it is spreading at that sort of speed and it becomes a sort of inevitability that everyone's going to get some form of mild COVID, therefore, or less severe COVID, perhaps this new strain is doing us a favour?
Well, in the very long term, yes, it's the next part of the roller coaster, and who knows where we're headed, but I'm not completely attuned with the optimism that I'm seeing in the British press today, because I see a situation where we were on a difficult plateau with Delta, with 50,000 cases per day and very full hospitals and very full intensive care units, and we've overlaid on top of that an enormous caseload of Omicron, with now 1 in 25 where I'm sitting in London currently infected. And again, the most severe of those will end up in hospital. It'll just be fewer than would have been for Delta. So at the moment, I can't quite see the way out.
Do you think the numbers are a bit skewed, perhaps? Because we're not really comparing like with like. If we're comparing the situation today with the situation a couple of months ago, when far fewer people were vaccinated, is that perhaps why people have got a more mild or less severe version of the virus, perhaps?
Sure. I think we have to be very, very nimble in our thinking, don't we? Because the situation moves so fast, and it's foolhardy to try and compare things to 6 months ago or a year ago or 2 years ago. As you say, we've got a variably heavily vaccinated population, and that's giving us some mitigation, and we need more mitigation.
And just tell us, I mean, the life cycle of a virus. I mean, I'm no scientist, but I'm given to believe that viruses do gradually weaken and disappear. Could this be the phase we're at right now with COVID-19, that this new strain is a weaker version and a sign, therefore, that the virus will slowly disappear?
Well, I think the first point I'd make is that this kind of long-term crystal ball gazing is the bit where the scientists most diverge and we least disagree with each other. Yeah. So yes, it is true that in general, their life cycle is to get better at transmission and less severe. But if you look at the other coronaviruses, the common cold viruses, that took variably between perhaps several hundred years or more than 1,000 years to happen. So the timeline for that process is unclear.
And you mentioned, we were talking earlier on about the record numbers of cases in the United Kingdom at the moment. Is that translating into a record workload for people in the healthcare sector? Is that what the situation is right now in emergency rooms and intensive care across the UK? A very, very severe workload for those employed in that sector?
I can't emphasize that sufficiently. Obviously, to talk about being at breaking point has been the new normal over the last 2 years. But these really are people, absolutely at breaking point. Hospitals getting very full, intensive care units getting very full, and staff just unclear how they're going to get through this winter.
And just lastly, someone who wants to celebrate the holidays in a responsible way without putting friends or loved ones in danger, what sort of advice would you give to people?
I think people are getting it on board, the kind of sensible precautions they need. So really take those lateral flow tests seriously, do them quite frequently before you're going to meet with relatives, especially elderly relatives. Do everything that you can do out of doors and minimize mixing with other households as far as you can, and dangerous things like going out singing and stuff like that. I think people have got that now.
Okay, well, thank you